Type it faster. I love that. There are some sufferers who deal with paresthesia in the leg, face, and pain in the jaw and ears. Some sufferers also have periods of difficulty breathing. Elaboration. Yes, I can elaborate. I do that a lot. Some people complain if I elaborate for too long. I think that's a great question. We know that some patients get symptoms in unexpected areas, like the legs, or like headaches, or jaw pain. So it's not just the upper extremities. And we don't have any solid proof of why this is happening. But the docs I know, the TOS docs who are aware and who pay attention to these extra things instead of trying to fit everything in one little box, they've seen this. Not a lot of patients, but some patients. So one of the docs I work with believes that the drainage from the spinal cord, the venous drainage, as it leaves the spinal cord, gets blocked up somehow. And that causes the spinal cord to not function as well. And that's why these sensations from the lower extremities pop through. And there is some evidence to that because the veins of the spinal cord in the spinal canal, the bony canal, tend to go up here and drain to the veins in the back of the skull. That's kind of a long way to go. We also know that the veins in the neck, sometimes up here due to unusual bony structures, a little larger than normal, can get compressed. And we know that the veins can get compressed here in patients with TOS. So there's plenty of evidence that the veins can get blocked temporarily, but can cause a backup of fluid and edema into the arms and other areas. I won't go through some of the medical papers on this, but it is possible that abnormal venous drainage affects the spinal cord, or venous drainage from the head and neck is directly affected by what's happening right here. So people can get venous types of TOS without a frank blood clot. We think that there's abnormal pressure in the veins when you press on them too much here, and that can affect the arms as well as the head and neck. So headaches are pretty common in TOS patients.